Hi, welcome to Revital Vision Clinical Evidence Review presentation. My name is Yair Yahav. I'm the CEO and founder of Revital Vision. This presentation reviews Revital Vision clinical studies. This table summarizes the data of 6 published studies which evaluated Revital Vision's efficacy on amblyopia. 4 of them are randomized control studies, and 2 are single-arm studies demonstrating efficacy beyond patching. 5 of the studies are on amblyopic adults with an average improvement of 2.5 lines. I will review these studies in more details during my presentation. I would like to start with the most recent study published in September 2024 in the American Journal of Ophthalmology. This is a randomized controlled double-blind study on patients with non-progressive keratoconus who were intolerant to contact lenses. The goal of the study was to test the efficacy on improving patients' best spectacle-corrected vision. There were 17 patients with a mean age of 28 years old in the treatment group who were treated with Revital Vision, and 18 patients with mean age of 24 in the placebo group, who were trained with placebo treatment, which is available on Revital Vision's platform, which uses Gabor patches that are non-specific to the patient. The average VA improvement in the study group was 1.7 lines logMAR versus 0.2 lines in the control group, which was statistically significant, with 8 out of 17 patients improving 2 lines or more. This improvement was found stable after 6 months post-treatment. There was an improvement in contrast sensitivity function in the treatment group. Patients with worse initial vision achieved better improvement. No side effects was found, and there was no subjects withdraw from the study due to compliance or training difficulties. In conclusion, 3 months of Revital Vision perceptual learning improved vision in keratoconus patients with stable results. The results indicates that Revital Vision may be a promising therapy for keratoconus patients with unsatisfied spectacle-corrected vision. This congenital nystagmus study was presented at the recent APOS annual meeting in Austin. It's a prospective randomized control study evaluating the efficacy of Revital Vision in improving best corrected vision in patients with congenital nystagmus, age 9 to 55, with stable, with baseline best corrected vision between 2040 and 2200. They did 60 training sessions during 4 months period and were followed up 6 months post-treatment. The results were significant improvement in near and distance VA, which enabled 23% of them achieve functional vision. There was a significant improvement in stereopsis, and 8 out of 9 patients without binocular vision gained binocular vision. This keratoconus study was presented at the recent ASCRS meeting annual meeting in Boston. It is a randomized control study evaluated the efficacy of Revital Vision in improving best corrected vision in patients with stable keratoconus with at least 1 year post cross-linking surgery, with baseline best corrected vision between 2040 and 2100. They did 40 training sessions during a 3-month period and were followed up 6 months post-treatment. The results were 2.5 lines improvement in distance VA and a 100% average improvement in contrast sensitivity function. Imagine the impact on patients' quality of life, which enabled many of them to cross the vision threshold required to drive a car. This post-cataract study was presented at the recent ASCRS annual meeting in Boston. It is a randomized control study evaluating the efficacy of Revital Vision in improving habitual vision in post-cataract patients with multifocal implants. Subjects, age 50 to 80. 4 to 24 weeks post-cataract surgery with Alcon PanOptix and J&J techniques, with best-corrected visual acuity at baseline 20/30 or better, and uncorrected visual acuity at baseline 20/20 up to 20/50. Contrast sensitivity function below normal range. The participants were unhappy patients complaining on vision quality. They underwent 30 home training sessions during 2 months period. They improved 2.5 lines in distance visual acuity and 83% in contrast sensitivity function. There was no improvement in the control group who had no treatment. This is an ongoing keratoconus study at Shamir Medical Center, detailing the clinical outcome of the first 11 study patients. It's a controlled randomized study on patients with keratoconus with poor best-corrected vision. Some are using scleral lenses, but still lacking good vision. Similar to the 2 other keratoconus studies, the average improvement was 2.5 lines improvement in best-corrected visual acuity and significant improvement in contrast sensitivity function. This amblyopia study was submitted to the FDA as a part of Revital Vision FDA submission, previously named Neurovision. The study was later published in PNAS. It is a controlled randomized study on adult patients with amblyopia, age 9 to 55. The control group were treated with placebo treatment using Gapor patches without the algorithm that tailors the visual stimulation to specific patients' needs. Patients' average best-corrected vision at baseline was 20/50 in both groups, with the study group improving more than 2 lines in best-corrected visual acuity with 1-year follow-up, measuring stable improvement, which was statistically significant against the control group. This is the contrast sensitivity of the same study. The gray area represents the normal range across the 5 different spatial frequencies. The red line is the baseline measurement, improving to the blue line post-treatment, and continues to improve to the green line 1 year post-treatment with a 100% improvement on average. It seems there is a continuous learning curve when the brain is using the amblyopic eye as a result of the anti-suppression effect. There was no correlation between the amblyopia type and the vision improvement. All groups achieved similar clinical outcome of more than 2 lines. Patient age did not impact the improvement either. There was similar clinical outcomes across all age group beyond the critical age. Most study patients experienced stereo improvement. And look at the improvement in binocular function, how many patients move from suppression to fusion, gaining binocular vision. The likelihood to experience an anti-suppression effect is also correlated with the VA gap between the eyes. Note that the study average best-corrected visual acuity at baseline was 20/50. It is less likely to gain binocular vision if the initial VA gap is very high. This adult amblyopia study was published in Clinical Ophthalmology. It's a controlled randomized study on 99 patients aged 9 to 50 with anisometropic amblyopia with best corrected vision of 20/50 at baseline. The treatment group underwent Revital Vision therapy for 40 sessions in a 3 months period, and the control group underwent placebo treatment with the same amount of time playing computer games. The average improvement was 2.6 lines logMAR in best-corrected VA, persisted in 8 months. And a 100% improvement in contrast sensitivity function with continuous improvement post-treatment. This study was published in 2022 in Journal of Clinical Medicine. It's a controlled randomized study evaluating the efficacy of Revital Vision in amblyopic patients post-keratoplasty. They are congenital limbal dermoid patients, age 8.5 to 12 years old, born with a non-malignant corneal tumor, which by the time they were able to undergo corneal transplant, they developed amblyopia from deprivation, challenging patients with severe amblyopia. The study group underwent 6 months Revital Vision training plus standard patching therapy, and the control group were treated with standard patching alone. The clinical outcome was significant improvement of 3 logMAR lines in best-corrected visual acuity and a 100% improvement in contrast sensitivity function. There was no improvement in the control group, and this was statistically significant. This study, published in 2022 in the Journal of Vision Development and Rehabilitation, COVD. It is a prospective single-arm study evaluating the efficacy of Revital Vision on adults amblyopic patients who are resistant to 6 months occlusion therapy. 45 study patients age 8 to 48 with best-corrected VA of 2070 at baseline and 2045 post 3 months treatment, improving 2.2 lines, proving efficacy of Revital Vision in adults beyond patching. A long-term 5 years follow-up results will be presented at the forthcoming annual APOS meeting in Salt Lake City in March 2025. This study on children with amblyopia was published in Vision Research. It's a prospective single-arm study on 5 children aged 7 to 8 who were resistant to occlusion therapy or were non-compliant. They improved 2.2 logMAR lines. The result is consistent with the comparison made by Levy and Lee in 2009 between patching and perceptual learning. They showed that about 20 hours of Revital Vision perceptual learning in adults is equal to about 500 hours of patching. This amblyopia study was published in Restorative Neurology and Neuroscience in 2021. It's a controlled randomized study on patients with albinism, amblyopia, and nystagmus. The study demonstrated 2.1 line logMAR improvement in the treatment group versus control with normal vision. Low myopia study in Singapore Eye Research Institute. This study was published in JCRS, the Journal of Cataract and Refractive Surgery. The goal of the study was to test the efficacy of Revital Vision in improving uncorrected vision in low myopia patients. The study included 20 subjects with mean age of 34 and with mean refraction of -1 diopter, with uncorrected vision of 20/40 VA at baseline, improving to 20/25 post 30 training sessions in a 2 months period. The 2.5 lines improvement in uncorrected vision remained stable 12 months post-treatment. This is the uncorrected contrast sensitivity results of the same study with a 100% average improvement within the normal range and stable results at 1 year post-treatment. A questionnaire evaluating the subjective impact on patients revealed that the majority of them reduced or stopped the usage of glasses or contact lenses. Another controlled randomized study published in Trans-American Ophthalmology demonstrated similar clinical outcomes of 2.5 lines improvement in uncorrected distance VA in low myopia, and the same in uncorrected near VA in early presbyopia, with a 100% increase in contrast sensitivity. A controlled randomized study on low myopia conducted by Singapore Eye Research Institute demonstrated statistically significant improvement in uncorrected distance vision against placebo with no changes in objective refraction or in accommodative amplitude. An additional presbyopia study demonstrated 2.5 lines improvement in near uncorrected vision with stable results at 6 months following treatment. A Stargardt disease study published in eChronicon demonstrated between 2 and 3 lines of improvement in best corrected vision in 10 eyes of 5 patients, offering hope to people with Stargardt disease who are lacking alternative treatment to improve vision. In this retrospective study, the data from 28 patients with congenital nystagmus who underwent revital vision treatment was collected and analyzed. The average improvement was 2 lines in best corrected visual acuity. In this chart, we can see the distribution of VA improvement in 47 eyes that participated in the study. The columns crossing the green line represent eyes who cross the 20/40 VA or better, achieving vision which is legal to drive. Imagine the improvement in their quality of life. This is a study on 60 patients, 2 months post-cataract surgery with mean age of 68 years old. It includes patients with monofocal as well as multifocal lenses of different manufacturers. The average improvement in vision was 1.3 lines for distance, 1 line for near, and a 150% improvement in contrast sensitivity function. And this is the contrast sensitivity improvement of the post-cataract study. The patient who participated in this study had low contrast sensitivity at baseline below normal range, which explains the poor vision quality they experience. Multifocal lenses target several focal points, and neurons in the primary visual cortex are sensitive to process just one type of visual stimulation based on location, orientation, and spatial frequency. Different focal points at different locations stimulates different groups of neurons, which leads to increased neural activity and neural noise that leads to decrease in contrast sensitivity function. This is one of the earliest studies presented at ESCRS on 3 groups of patients: post-cataract surgery patients, keratoconus patients with intrastromal corneal rings, and patients with retinitis pigmentosa. All of the patients improved between 1.3 to 3 lines. This is the improvement in the post-cataract group. Look at the remarkable improvement in distance and intermediate VA and the contrast sensitivity improvement in both eyes, left and right. This is the supervision study on 11 subjects with normal 20/20 vision, habitual vision. They improved 1 line in visual acuity and 50% in contrast sensitivity function, which is half of the improvement achieved in other studies. The high contrast starting point leaves less room for improvement, which explains the moderate improvement in these normal vision subjects. A study on a larger group of low myopia and post-LASIK patients demonstrated 2.5 lines of improvement with stable results 1 year post-training. And 24 months follow-up shows stable results. There was a slight VA regression, but more than 2 lines stable improvement after 2 years. And lastly, the contrast sensitivity was stable at 24 months post-treatment. This concludes the Revital Vision Clinical Evidence Review presentation. Thank you very much for listening. The full version of Revital Vision studies are available on Revital Vision website under Science.